The next set of questions, we will hear about a truly local project innovation of how PATH really engaged the community and engaged the community volunteers. And, you know, I was struck in the video by the physician saying he heard about it in the community as one of the catalysts for how he got interested. So the power of this is quite remarkable. And so we've got 3 community volunteers who have participated in helping seniors participate in this process and help them move through the system based on what the individual senior said that they needed. And so I'm going to ask questions to each of Kelly Robinson, YMCA Volunteer Transition Coach Coordinator, and to Joanne Domini, Volunteer Transition Coach, and Jack Russell, Volunteer Transition Coach and Chair of the Northumberland Hills Hospital Board of Directors. So I have a question for each one of you. And Kelly, you are first. Why is the PATH Volunteer Transition Coach element of the project important to the community? Would you like to come up here?
That's my only question.
Okay, yes. Or you can pass the
I think, yeah. Thank you, Leslie. The volunteer transition coach element of the project is important to the PATH community and the community at large because with our expanding population of seniors in Northumberland County, the support, the connectivity, and the empowerment that the coaches provide to the PATH patients and caregivers is extremely valued and needed. We currently have 30 coaches in the age ranges of 30s to 70s. However, the vast majority of them are over the age of 60, so they are helping their fellow seniors to transition through the healthcare system with less stress and more success. This directly follows the purpose of the transition coach model, which states that coaches will ensure that seniors and caregivers have the opportunity to receive support from a peer volunteer coach who will help them navigate the transitions in their healthcare experiences. Our coaches, who take their work with their patients and caregivers very seriously and with much care and compassion, offer respectful guidance on the challenging technology part of PATH and also assist with other aspects of the coach role, such as advocacy, connecting and communicating, educating and accessing community services, and supporting and encouragement. They are filling a gap in our community. And with some of them working with 2 or 3 patients at a time, they are now servicing over 60 patients and caregivers. There is considerable amount of technology in the PATH project, as we've seen, and the volunteer transition coaches are the critical people part of the project that allow the seniors to feel more comfortable using the technology, staying with the technology, and in the end, experiencing success with the technology. Our coaches are now also helping at our hospital by accompanying patients in post-acute care to out-of-town appointments if they have no one else to go with them. This reflects yet another important need for the transition coaches in our community. Our coaches feel valued by the PATH project and their community because they know they are fulfilling a need for our seniors and for our healthcare providers and system. The PATH pilot project and ultimately the healthcare community have benefited so far from this service and continue to benefit. They are grateful for these dedicated, empathetic, and kind-hearted individuals who have taken on this very key role of volunteer transition coach. Thank you.
Thank you. So Joanne, why did you get involved in the Volunteer Transition Coach program for PATH? And what is the impact of the coaches?
A great impact. Whoops, am I on?
Let's see. Musical mics.
Can you hear me? No?
Okay, welcome to the podium.
Shall we share? We could shout. Oh, go ahead. Very good.
One of the adjectives that Kelly missed is it's an honor for us to be a transition coach. I came on board. Thank you. I came on board because my husband has at least 7 specialists at this point. I'm his caregiver. When we initially went to the very first pass open house back in about early spring, I hoped we would be caregiver and patient. Jim's doctor is not the first one in the PATH project. He's now there in the second phase with a different coach. So I came on board in that way. I was offered the opportunity to be a volunteer transition coach, and I said, yes, I'll find out what it's all about. I'll learn. We'll find out together. Not only do I have a husband that was lacking, but I have a sister who is now getting close to the tail end of Alzheimer's. And thanks to our Mary Ann down there, stand up, Mary Ann, please. Our gerontologist come everything, wonderful person. You need to be having a spokesperson for people who can't. Many people of my age and over, and it's not only up to 70s, I'm way over, we don't have the ability, the sense, we feel too proud to. We don't talk about our problems. You need to be pushy, like me. That's why I joined the team.
Fantastic, thank you.
You want to know my role?
Yes, please.
Oh, I thought you were supposed to ask me more questions. But I'll carry on.
Why don't we invite Jack, and then we can, or did you have more to say here?
Oh, well, I probably the same as Jack. Come on up, Jack.
Excellent.
I was too comfortable there in that chair.
Why don't you stand up here as well? And Jack, I'm going to ask you, why did you get involved in the Volunteer Transition Coach program of PATH, and what is the impact of the coaches from your perspective?
I'll try and answer that for you.
Okay.
First, I'd like to say good morning to everyone.
Oh, I didn't.
And I want to just add my thanks to the Change Foundation for the opportunity that it has granted to the residents of Northumberland County, and particularly West Northumberland, for the opportunity to have this program. I hope that one day in the future, the benefits that we see and you're all hearing about now are going to be available to more people throughout this province. So, Leslie, you asked me the question, why did I volunteer to be a transition coach? Well, there were really 2 reasons that I'll tell you about. The first is this thing that I like to refer to as magnetic pull. And it's a pull that you feel when you have people that present something that they're really passionate about and really motivated in. And that happened for me over the course of the last couple of years, sitting at board meetings and having Helen Brenner and Wendy Kay. Wendy, stand up. Wendy is a fantastic proponent for PATH. You know, when you hear how excited and enthused they are about the project, you know you want to be part of that, because you know you want to be part of trying to make this thing successful. And we all know that throwing money at things is not always the answer. And the volunteer transition coach, I think, has a fantastic role to play and a fantastic benefit for this program. The second reason that I joined stems from the fact that for the past few years, my mother has transitioned from her own apartment to a retirement home, and then on to a retirement home with nursing assist, and finally to a long-term care facility that was able to provide for her what I'll call an increasing state of dementia. Luckily, we have a very large family, and my siblings were able to provide a tremendous amount of support to my mom, taking her to medical appointments, making sure she kept up with all of her meds, and simply being there to help her as time went on and her condition worsened and she wasn't able to do as many things for herself. But because I didn't live in the same community, I wasn't able to contribute my share. At least that's what I felt. And so I said, I want to try to make that up in some other way, and that maybe I can help some other seniors in Cobourg, and maybe seniors who aren't quite as fortunate to have as much family caregiver support available to them, and we know that that's the case in a lot of communities. So I saw PATH as a perfect opportunity. So if I could go on, I'll just answer some questions of the benefits I see. In working with 3 PATH clients over the past several months, I've witnessed firsthand the tremendous increase of empowerment that takes place when you take time to share information and knowledge about the healthcare services that exist in your community. This PATH website, Pathway to Aging Well, you've seen it on the slides and so on. It is a goldmine of information. And as a coach, we become more and more familiar with that information every time we use it with a client. So we become smarter, and we in turn can provide more information to future clients. That's a real future benefit that's going to come about, I think. And all in all, having that information, we see it day in and day out. It reduces frustration as the patients make their transitions through the system. Another example of this empowerment, I had a case recently where a caregiver of one of my clients, his spouse, she actually felt that she was being left behind in the process a little bit, because she said her husband was becoming so independent and was monitoring and recording his blood pressure, his activities of daily living, entering all this information into the portal. I guess the lesson learned is do your best to keep the caregiver in the loop at all times so that they can also become more empowered, another resource for the future. And the other thing is it helps us so that we don't have to try and fill the role of marriage counselor. So I wrapped up my work with one client just last week, and I asked him, as I was finishing up, I said, what is the greatest benefit that you see to PATH, or from PATH, for you? And without a beat, he said, and I quote, I know now that I am the one who is responsible for my health, and I know how to be better prepared for my doctor's appointments. And then after those visits, I feel like I'm in control. I know more about my conditions, and as a result, I feel better both physically and emotionally. So in closing, when a client tells you that they feel so much better about their level of knowledge, and they get excited showing you their monitor, they're showing you the data that they're entering into the system, and how much being on top of things improves their health and well-being. Well, when it's time to say goodbye to that particular patient, you have a really good feeling inside. Thanks for the opportunity to share.